So if we see data, around 20 to 30% of the Indian population are suffering from allergic rhinitis. So then what is allergic rhinitis? It's a immunological mediated disorder provoked by different types of allergen.
To help us understand, we are joined by Dr. Aniruddha Majumadar, ENT specialist, professor of ENT at Department of EMT, Midnapore College of Kolkata.
In allergy patient, as a clinician, diagnosis is very, very important because an diagnosis can only be done with proper history. History is most important, and then comes with some investigation. If we see the diagnostic pattern now in India, there is a dynamic change in the treatment part and diagnosis part. Because initially only allergen specific immunoglobulin E we used to detect, but nowadays the gold standard is the skin prick test. And another very important is component resolved diagnosis. That is the most accurate diagnosis we can make from the history, and if we properly diagnose it, we can treat properly. And if we treat properly, the other comorbid condition will be controlled. Awareness plays a very, very important role. If the awareness is increased, avoidance can be made. And allergen avoidance is very important aspect of allergic treatment. And it helps in lifestyle modification also plays a very, very important role. Like regular exercise, yoga, pranayam, and Jalniti awarenesses are increasing, but in urban society they are aware, but we need to work more.
Hello and welcome to the very special edition of Allergy Uncovered, an initiative by Voice of Healthcare and supported by BSV Mankind. So when we think of allergies, most of us picture a seasonal sneeze, a runny nose, or an occasional itch, right? So, but allergies are far more than that minor inconvenience. They affect productivity, sleep, mental well-being, and the overall quality of life for millions across India. So, at the National Allergy Summit, we are bringing together the leading pulmonologist and ENT specialist from across the regions to decode the evolving medical landscape of allergy care, from smarter diagnosis and emerging triggers to integrated patient-centric management. And to help us understand, we are joined by Dr. Aniruddha Majumadar, ENT specialist, professor of ENT at Department of EMT, Midnapore College of Kolkata. Welcome to our show, sir.
Thank you.
Thank you so much for joining, sir.
Thank you.
Sir, to begin this conversation about allergy, so from your experience, how would you describe the current landscape of allergic rhinitis and ENT related allergies? Has the pattern changed over the years?
Yes, this topic is very, very important because in India is a huge country, is a huge population. So if we see data, around 20 to 30% of the Indian population are suffering from allergic rhinitis. So then what is allergic rhinitis? It's a immunological mediated disorder that it's provoked by different types of allergen like aeroallergen and food allergen, that is called ingested allergen. So why it is important? Because it's a huge socioeconomic aspect of this pathophysiology. There's a huge impact on humans' day-to-day life because it's not only is a local nasal disease, it's a systemic disease. Why? Because it's one airway, one disease. If we don't treat allergic rhinitis properly, it will present to us in a different comorbid condition like recurrent rhinosinusitis. Nowadays, we can see even in adult patient, they are suffering from huge adenoid size is increasing and leads to obstructive sleep apnea and recurrent URTI. And in the long run, patient will land up in the asthma. So we cannot cure asthma, we can only control the asthma. So treating allergic rhinitis is very, very important. And it doesn't present to us only with nasal symptoms. They are present with depending on the spectrum of disease. Like in pediatric patient, they are coming with otological symptoms. Like patient coming to us with hearing loss, that is called OME. and sometimes huge adenoid is as a obstructive sleep apnea. So these are all manifestation of allergy. So it's very important. If we don't give awareness to our patient, they will just go over the counter, they will take anti-allergic, and it may symptomatically patient may feel better for the time being, but in long run patient will land up in a other chronic diseases.
Thank you, sir. Thank you so much for shedding light on that and how important it is to take timely action.
Yes.
Sir, in your practice, where do you see the biggest gap is? Is it awareness, that timely diagnosis, or some long-term compliance in allergy management?
Yes, already we have discussed few points in that. Awareness is very poor in our locality, in our patients, because whether it's urban or rural, the health awareness is very less. So awareness is very important because our patient doesn't know what is allergy, and there are different types of allergen they should understand. It may be seasonal allergen, maybe it's a perennial round the year. Seasonal allergic rhinitis or allergen, it is a pollen, and it's depending on the part of India. If it is a eastern India, pollens are different. If it is a northern India, there are different pollen. So that type of awareness is very less in our patient. So what, as a clinician, as a ENT surgeon, if we find if they come to us, we educate them, because treating with only medication is not our it's complete the job. It's halfway. So if we don't aware the patient that how it will happen, what are the comorbidities, they don't take it seriously. So even though we give full treatment, they don't take the treatment in full course. So they are land up in other comorbid condition. So awareness is very, very important.
Thank you so much, sir, for emphasizing on that how awareness can entirely change the landscape
Yes,
of
definitely.
allergy in our country. So, talking about the diagnosis. So,
Yes.
how important is the early and accurate diagnosis in preventing the chronic sinus and airway complication in allergy patients?
Yes, in allergy patient, as a clinician, diagnosis is very, very important, because an diagnosis can only be done with proper history. History is most important, and then comes with some investigation. If we see the diagnostic pattern now in India, that there is a dynamic change in the treatment part and diagnosis part, because initially we'll only allergen specific immunoglobulin E we used to detect, but nowadays the gold standard is the skin prick test. And another very important is component resolved diagnosis. That is the most accurate diagnosis we can make from the history. And if we properly diagnose it, we can treat properly. And if we treat properly, the other comorbid condition will be controlled better way.
I think so, sir. That way it will be controlled. So, as an ENT specialist, how do you see that interdisciplinary collaboration, particularly with pulmonologists and dermatologists, are improving the overall allergy outcomes?
Because as a ENT, what I'll say, allergic rhinitis is not a local nasal disease. ENT disease is a systemic disease, and it doesn't come overnight. If we take history, pediatric age group, atopic chain, atopy is a genetic condition, and from that genetic condition, that cascade allergic march happen. So, and if we don't restrict or don't prevent the allergic march, it will go land up into the allergic asthma. So very, very important is clinical history and diagnosis, and moreover awareness. And most importantly, allergic condition avoidance. If we aware the patient, we make our patient aware, they can avoid, because in treatment only pharmacology doesn't help. So awareness plays a very very important role. How? If the awareness is increased, avoidance can be made, and allergen avoidance is very important aspect of allergic treatment, and it helps in lifestyle modification also plays a very very important role, like regular exercise, yoga, pranayam, and jalniti. In 400 500 years ago, there was no antihistamine, there was no histoglobe, there was no any immunotherapy. So only lifestyle modification, jalniti. Nowadays also in our treatment we have incorporated jalniti in a modern form, in the form of their nasal wash. So these are very very important for treatment aspect. So in a nutshell, we can say allergic rhinitis is a systemic disease, and in India around 20 to 30% people are suffering from allergic rhinitis, and awareness is very very important, because if we aware the patient, they can avoid allergen, and maximum problem can be solved, and rest of the problem pharmacotherapy can handle. And along with pharmacotherapy, nowadays another line of treatment is immunotherapy. In immunotherapy, what we do, we immunomodulate the system. So WHO, World Health Organization, and different allergic bodies, area, GINA, there are so many papers across the globe. They have stated that immunotherapy is the only treatment we can cure the allergy.
You rightly mentioned, sir. And so, with that, we move on to our rapid fire round, where I expect some fiery and quick answers from you. So, that one symptom of allergic rhinitis is most commonly ignored by patients.
Sneezing. They sneeze. They keep on sneezing. They think it can be due to dust. There is no dust at all. They are all allergen. So they ignore these symptoms.
One investigation in allergy care that deserves greater attention in routine practice.
As a clinician, I'll say skin prick test is the most important test. It's a gold standard in allergy diagnosis.
Okay. And how would you describe the patient awareness about allergies today? Improving or still limited?
Yes, awarenesses are increasing, and with that, patients. But in urban society, they are aware, but we need to walk more. We have to. There are different programs like podcast. There are some CMEs. There are some talk show we can do, and we can increase the awareness about the allergy.
So, one lifestyle modification you would suggest that can significantly reduce the allergy burden?
Yes, lifestyle modification is very very important. Physical activity is very very important, like physical activity in the form of yoga, pranayam. So what they are doing, they will balance, they will sympathetic and parasympathetic nervous system. There should be a balance. With yoga and pranayam, it will be balanced. Very very important lifestyle modification.
I agree. So I think it resolves lot many issues if we are active physically and we take care of our health.
Definitely.
Thank you, sir. With that,
Thank you.
we have come to end of our discussion. Like we begin with that, allergy always begins with a sneeze, but it is much more than that. Like Dr. Majumdar just explained us. So thank you so much, sir, for joining
Thank you.
us and sharing your expertise with us.
Thank you.
Thank you, sir.
Okay.